Hello, and welcome. Today we're diving into oral lichen planus, a chronic inflammatory condition that affects the mucous membranes inside your mouth. While it's not contagious, it can cause discomfort and pain. Let's explore what oral lichen planus is all about. The exact cause of oral lichen planus remains a mystery. However, it's considered an autoimmune disorder, meaning your immune system mistakenly attacks healthy cells in your mouth. Certain factors may trigger oral lichen planus, including infections like hepatitis C, certain medications like NSAIDs or blood pressure medications, stress, and even dental materials. It's important to remember that these are potential triggers and not direct causes. The pathophysiology of oral lichen planus involves a complex interplay of immune cells and inflammatory mediators. T lymphocytes, a type of white blood cell, infiltrate the oral mucosa, leading to the destruction of basal keratinocytes, which are the cells that form the base layer of the oral epithelium. This immune response causes inflammation and the characteristic lesions associated with the condition. The chronic nature of the inflammation can lead to long-term changes in the oral tissues. Oral lichen planus is relatively common, affecting approximately 0.5 to 2% of the adult population worldwide. It's more prevalent in women than in men, typically appearing in middle age, between 30 and 60 years old. While it can occur in people of all races and ethnicities, some studies suggest variations in prevalence based on geographic location. Oral lichen planus manifests in various ways. The most common sign is the appearance of white, lacy patches, often described as Wickham's striae. These patches are usually found on the inside of the cheeks, but can also occur on the gums, tongue, lips, and palate. Other symptoms include redness, swelling, open sores or ulcers, pain or burning sensations, especially when eating spicy or acidic foods, and thickening of the oral mucosa. In some cases, oral lichen planus can also affect other areas of the body, such as the skin, scalp, nails, and genitals. Diagnosing oral lichen planus typically involves a thorough clinical examination by a dentist or oral surgeon. They'll assess the appearance and distribution of the lesions. A biopsy, where a small tissue sample is taken for microscopic examination, is often necessary to confirm the diagnosis and rule out other conditions like oral cancer, candidiasis, or leukoplakia. Further blood tests might be conducted to check for underlying conditions like hepatitis C. Oral lichen planus can be classified into several types based on its clinical presentation. The most common types include reticular, which presents as white lacy patches, erosive, characterized by painful ulcers, papular, with small, raised buntrophic, showing red, smooth areas, and bullous, featuring blisters. It's important to note that these types can overlap, and the presentation can change over time. While there's no cure for oral lichen planus, the goal of treatment is to manage symptoms and reduce inflammation. Treatment options include topical corticosteroids, which are applied directly to the affected areas to reduce inflammation and pain. In more severe cases, systemic corticosteroids, taken orally, may be prescribed. Other medications, such as topical calcineurin inhibitors or retinoids, may also be used. Maintaining good oral hygiene, avoiding irritating foods and substances, and managing stress are also important aspects of managing the condition. Unfortunately, there's no known way to definitively prevent oral lichen planus. However, minimizing potential triggers may help. This includes maintaining good oral hygiene, avoiding irritants like smoking and alcohol, managing stress, and discussing alternative medications with your doctor if you suspect your current medications are contributing to the condition. Regular dental check-ups are crucial for early detection and management. The prognosis for oral lichen planus varies from person to person. Some individuals experience periods of remission, where symptoms disappear, followed by flare-ups. Others have persistent symptoms. While oral lichen planus is not life-threatening, the erosive form, particularly if it persists for a long time, has a slightly increased risk of developing into oral cancer. Therefore, regular follow-up appointments with your dentist or oral surgeon are essential for monitoring the condition and detecting any changes early. Recent research has focused on understanding the specific immune pathways involved in oral lichen planus and developing more targeted therapies with fewer side effects. Clinical trials are ongoing to evaluate the effectiveness of new drugs and treatment approaches.